The lithotomy legacy, a position ingrained in our minds. For generations, the image of childbirth has been intertwined with a specific position, the lithotomy position. This posture, where the birthing person lies on their back with legs raised and supported by stirrups, has become so ubiquitous that it's often seen as the default, even the only option, for labor and delivery. This position is so deeply ingrained in our minds that many people can't even imagine childbirth happening in any other way. Popular media often portrays childbirth in this manner, further cementing the image in our collective consciousness. From TV shows to movies, the lithotomy position is depicted as the norm, reinforcing its status as the standard. However, this seemingly standard position is a relatively recent development in human history, gaining prominence with the rise of medicalized childbirth in the 20th century. Before this shift, childbirth was a more varied and culturally rich experience. Before the advent of modern obstetrics, women around the world birthed in a variety of positions, often utilizing upright postures that took advantage of gravity and the natural mechanics of the body. These positions were not only practical, but also aligned with the body's natural birthing process. These traditional birthing positions, passed down through generations, were not merely cultural preferences. They were rooted in practicality and an intimate understanding of the birthing process. Midwives and birthing assistants played crucial roles in supporting these natural positions. The rise of the lithotomy position, while convenient for medical practitioners, shifted the focus away from the birthing person's experience and towards ease of intervention. This shift often prioritized the needs of the medical staff over the comfort and autonomy of the birthing person. This shift towards a standardized, intervention-heavy approach to childbirth has led many to question the wisdom of adhering to a single position, particularly one that may not be the most beneficial for all women. The conversation around childbirth is evolving, with more emphasis on personalized care. The lithotomy position, while suitable for certain medical interventions, may not be the optimal choice for a physiological birth. It's important to consider the individual needs and preferences of the birthing person. It's time to re-examine the lithotomy position, not as a historical relic, but as a practice that deserves critical evaluation in light of its potential drawbacks. Medical professionals and birthing advocates are increasingly calling for a more nuanced approach. This exploration is not about demonizing the lithotomy position or dismissing its role in certain situations. Instead, it's about broadening our perspective and understanding the full spectrum of birthing options available. It's about expanding our understanding of birth, recognizing that one size does not fit all, and empowering women to make informed choices about their bodies and their births. Education and awareness are key to this empowerment. It's time to move beyond the singular narrative of the lithotomy position and embrace the diverse tapestry of birthing experiences. By doing so, we honor the individuality of each birthing journey and support a more holistic approach to childbirth. Unveiling the disadvantages why lithotomy falls short. While the lithotomy position has become synonymous with childbirth in many settings, it's crucial to acknowledge its potential disadvantages. Despite its widespread use, this position may not be the most beneficial for everyone. Research has shown that this position can make labor more difficult for some women. The angle and positioning can work against the natural forces of gravity, which are essential in aiding the birthing process. The supine position can compress major blood vessels, potentially reducing blood flow to the uterus and the baby. This compression can have significant implications for both maternal and fetal health. This decreased blood flow can lead to irregular fetal heart rate patterns, a concerning sign during labor. Monitoring these patterns becomes crucial to ensure the safety of both mother and child. Furthermore, the lithotomy position has been linked to an increased likelihood of interventions such as episiotomies and cesarean sections. These interventions, while sometimes necessary, come with their own set of risks and complications. The confined position can restrict the natural movements of the pelvis, making it more challenging for the baby to navigate the birth canal. This restriction can hinder the progress of labor. This restriction can lead to prolonged labor, increasing the chances of fetal distress and the need for surgical intervention. Prolonged labor can be exhausting and stressful for the birthing person. Beyond the physical challenges, the lithotomy position can also intensify pain for the birthing person. The discomfort can be overwhelming and may affect the overall birthing experience. Lying flat on the back can exacerbate back pain, a common discomfort during labor. This added pain can make it harder for the birthing person to cope with contractions. The position can also put pressure on the coccyx, causing additional pain and discomfort. This pressure can lead to lingering pain even after childbirth. Moreover, the lithotomy position can create a sense of disempowerment for the birthing person. Feeling out of control during such a critical moment can be deeply unsettling. Lying on the back with legs raised can make it difficult to move freely and actively participate in the birthing process. This lack of mobility can hinder the natural progression of labor. This sense of passivity can be emotionally challenging, potentially increasing anxiety and fear during labor. It's important to consider these factors when choosing a birthing position. Embracing gravity upright positions for a smoother birth. In contrast to the lithotomy position, upright birthing positions, such as standing, squatting, kneeling, and sitting, utilize gravity to facilitate a smoother labor and delivery. These positions are not only natural but also align with the body's instinctive movements during childbirth. When a woman is upright, gravity assists the baby's descent, encouraging the natural alignment of the baby's head with the cervix. This alignment is crucial for a more efficient and less painful labor process. This alignment can lead to more effective contractions, potentially shortening labor duration. Effective contractions are key to progressing labor smoothly and reducing the overall time spent in labor. Upright positions also allow for greater freedom of movement, enabling the birthing person to find positions that alleviate pain and enhance comfort. This freedom can be particularly beneficial in managing the intensity of contractions. The ability to shift and adjust the body can help ease back pain, reduce pressure on the perineum, and promote relaxation. Relaxation is essential for conserving energy and maintaining a positive mindset during labor. This freedom of movement can be empowering, allowing the birthing person to actively participate in the birthing process. Feeling in control can significantly impact the overall birthing experience, making it more positive and fulfilling. Furthermore, upright positions can improve blood flow to the uterus and the baby, ensuring an adequate oxygen supply. Adequate oxygenation is vital for the health and well-being of both the mother and the baby during labor. Improved blood flow can lead to more efficient contractions and reduce the risk of fetal distress. Efficient contractions help in the smooth progression of labor, minimizing complications. This enhanced circulation can also help minimize the risk of maternal hypotension, a potential complication associated with the lithotomy position. Maintaining stable blood pressure is crucial for the safety of the birthing person. The benefits of upright birthing positions extend beyond labor and delivery. They can contribute to a quicker recovery and a more positive postpartum experience. These positions can also facilitate a more comfortable and efficient pushing stage. Efficient pushing can reduce the physical strain on the birthing person. By utilizing gravity and optimizing pelvic alignment, upright positions can help the baby descend more easily, potentially reducing the need for interventions such as forceps or vacuum extraction. This can lead to a more natural and less invasive birth experience. Did you know that ancient birthing postures are making a comeback in modern times? These positions, often more natural and gravity-friendly, can ease the birthing process. By embracing these time-tested methods, many women find greater comfort and control during labor. Sitting and kneeling positions are not just comfortable, but they also allow for more control during childbirth. These postures can help to open the pelvis, making it easier for the baby to descend. Many women report feeling more empowered and connected to their bodies in these positions. It's important to collaborate with your healthcare provider to find the best birthing positions for you. Open communication ensures that your preferences are respected and that you have the support you need. Remember, your comfort and safety are the top priorities. Empowering women through knowledge and choice is essential in the birthing process. When women are informed about their options, they can make decisions that align with their needs and desires. Knowledge truly is power, and it can transform the birthing experience into a positive and fulfilling journey. Thank you for watching. Like, share, and subscribe.